when it comes to lawlessness and drug-fueled chaos, there is still no place quite like Vancouver's downtown east side. I met with Leo Knight, a retired Vancouver police officer, to ask him how the downtown east side had changed over the past 30 years.
People did not live on the streets back in the day in the downtown east side. There was no such thing as injecting drugs on the street. It just wouldn't happen. I guarantee you that if you go down the downtown east side right now, they're all drug addicts. The 100 East Hastings now it's a zoo. It's the largest open-air drug bazaar in the world.
Accompanied by rampant drug addiction and the mental health issues it brings, the downtown east side is a dangerous place. Marshall Smith was once a resident of the downtown east side before entering recovery and gradually rebuilding his life. Incredibly, rising to the rank of Chief of Staff to Alberta Premier Danielle Smith.
At some point around 2004, sort of lost my career to drug use and wound up hanging up my suit and tie at the legislature and vanishing into the streets of Vancouver, where I lived for 4.5 years as a homeless drug addict. Obviously, those were very dark and difficult times in my life.
As part of Marshall's role as Chief of Staff to the Premier, and because of his unique background and experience, he has helped spearhead Alberta's opioid response strategy over the past 4 years. A strategy that differs significantly from the one being pursued by David Eby in British Columbia and supported by Justin Trudeau.
We're willing to work with provinces who want to move forward on different steps. We're having good conversations with British Columbia about something they want to do there.
But they're specifically calling for decriminalizing drugs.
Yes, they are. And we are looking at where to do that. British Columbia is looking about that, talking with that, and we are working with them to see how we can move forward with them in the right way.
On January 31st, 2023, the government of BC granted approval by the federal government, made it legal to possess certain quantities of hard drugs, including crystal meth, heroin, fentanyl, and cocaine, declaring in no uncertain terms that open drug use was now legal on the streets of British Columbia. And the results were immediate and available for all to see.
How did that change on the ground, that you've seen with your own two eyes?
Oh, within the same day, everything changed. The next day it was tenfold. It was everywhere, people using like crazy.
There was a guy in the washroom shooting up, and they said, "Hey, you can't do this in here." And he said, "It's legal now. We can do whatever we want. So you can't stop us."
It's illegal to do drugs on school property or at the airport. The rest is fair game. And they actually said there's more stricter bylaws about smoking tobacco near my door than there is about drugs. So you can't smoke a cigarette near my door, but you can smoke meth.
All the rules are gone now. So it doesn't matter. You can openly smoke crack in front of a store, and someone that tells you got to move on is going to tell you where to go.
Is it easier to ticket or dissuade someone from drinking alcohol openly in public than using some of these other substances?
Well, we can actually do something.
Yeah.
When somebody's drinking in public, we can issue a ticket for, I think it's $230 for consuming in public. And where somebody is smoking a small amount of crystal meth or fentanyl, and it's under the 2.5 grams, there's nothing we can do if they're not within those sanctioned areas.
Candidly, we know that the police for the last 2 years, pretty much everywhere, have not been charging drug users who had small amounts anyway. If I walk down the street of Nine with a beer in my hand, I could be arrested and fined. But if I'm taking crystal meth sitting on the bench in front of everybody's favorite coffee shop, no big deal. It's that kind of approach, and again, as I understand the concept, but I must say, just as a human being and a citizen, it ain't saleable politically. It doesn't make sense, and no one honestly believes it's going to reduce the number of deaths from the toxic drug supply.
The only thing that does is empower the drug dealers and empower the gangs. Basically what you're doing is you're giving them the ability to have under the legal limit, and that they just have to do extra runs for the drugs.
But if police weren't arresting drug users for possession, why did Trudeau and the BC government push ahead with their plan to decriminalize drugs. Well, in their words, it's all part of their plan to destigmatize drug use across Canada, believing that this will somehow entice more drug users to seek treatment and recovery.
Through this exemption, we will be able to reduce the stigma, the fear and shame that keep people who use drugs silent about their use.
But is that actually true?
My experience is that people who are struggling with addiction don't really care about the stigma associated with possessing drugs or using drugs.
There is a certain narrative that if you say that's stigmatizing, one is supposed to inherently apologize. I should approve of everything. No one really believes that. It's a question of what do we stigmatize. The challenge is that sometimes shame and stigma are why people seek treatment.
We have never had more success when it comes to treating addiction in our society than we have with addiction to tobacco. And we take a very strong approach, right? We tell people that they should quit. We tell them that help is available. We make that help free. We help them in their recovery. We expose them to the consequences of their actions. We stigmatize them, right? For what they're doing. But for whatever reason, the drug user advocates have gone a different direction with other substances.
They started with this, what they call harm reduction, right? Trying to prevent the harms instead of preventing drug use. And I say the biggest form of harm reduction is preventing drug use in the first place. These people who sit in their little offices somewhere and have never dealt with an addict, have never treated an addict, have never talked even to an addict like I have, think that people don't go to treatment because of the stigma involved. Well, that's horse hockey. When someone's addicted, all they're capable of is thinking about how they get their next fix. The brain gets hijacked by the addiction. Harm reduction is like throwing in a life preserver, but leaving them in the river.
Over the past 20 years, drug prevention programs in British Columbia have been scaled back dramatically and replaced with what's known as harm reduction, ranging from the provision of naloxone kits to students as young as 15, to the distribution, in at least one case, of safer snorting kits at a high school on Vancouver Island. But in truth, these so-called harm reduction policies from government, along with decriminalization, are only just the beginning. Their real objective is something else entirely.
We know that anchoring ourselves in science and data, making sure that issues of harm reduction, safe consumption are put to the forefront. We will continue to be grounded in what works, in compassion, in evidence.
Making sure there's a safer supply so people who are addicted can get clean drug supplies as opposed to having to buy the dirty and deadly stuff.
Safe supply. It's a buzz phrase used by politicians and drug advocates alike, meant to instill public confidence that the powers that be are taking the overdose crisis seriously and are doing something about it. But what does it mean? According to Health Canada, safe supply or safer supply refers to providing prescribed medications as a safer alternative to the toxic illegal drug supply. Its intention is to help prevent overdoses and save lives. Now, at first glance, that sounds pretty good. But looking deeper into what safe supply really means, the sunshine and rainbows quickly fade into a dark dystopian nightmare.
You're looking at what's intended to be British Columbia's first legal cocaine lab.
On February 17, 2023, Ad Astra Holdings, a cannabis company based in Langley, BC, received approval from Health Canada to legally import cocoa leaves and manufacture cocaine. The company's CEO said in a press release that it will explore the commercialization of cocaine to provide a safe supply of the drug. This follows a ramping up of supposed harm reduction policies in the province, even the launch of vending machines containing heroin substitutes, all under the guise of safe supply. But this isn't just happening in BC. I traveled to London, Ontario, the epicenter of the push for safe supply in that province, to meet with Dr. Sharon Koivu, an expert in the field of addiction and safe supply. I wanted to know exactly how long this has been happening in London and where it all came from.
Safe Supply started in London in about 2012. There were lots of people who were very vulnerable, particularly people that were identified as being vulnerable were street-level sex workers. So the initial thought was to keep people safe so they don't have to be selling their bodies to get drugs, was to give them a prescription. And the prescription that was decided on was Dilaudid.
Dilaudid is the brand name for the opioid hydromorphone, a drug used in medical settings to reduce severe short-term pain.
This hydromorphone, for people that don't know, for including myself, is this kind of a low-level opioid, or is this a powerful?
No, it's a powerful addictive opioid. It's similar to OxyContin. It's a very powerful, very addictive opioid.
Once a last-ditch pain medication, hydromorphone has found its way into the Safe Supply program. It's now freely prescribed by doctors to addicts as a theoretical substitute for street drugs.
We are giving out huge amounts of a very highly addictive, very dangerous opioid narcotic.
Look, Safe Supply is a marketing term. It's not a medical term. It's a term that was made in a boardroom with communications experts and advocates, and it's made to communicate to people the feeling of safety. It's not safe.
You're referring to that as though it was safe, and it's not safe. I don't like calling it Safe Supply because it's not safe.
But how different really is hydromorphone from other opioids like fentanyl? How powerful is hydromorphone and how addictive can it be? To find out, I met with a pharmacist in BC who wished to remain anonymous for fear of losing her job.
Basically, the biggest one for Safe Supply is hydromorphone. Hydromorphone is like 20 times stronger than morphine. This whole term of like safe supply, like I'd like to know what the definition of safe is. There's no such thing as a safe opioid.
Did you be concerned if you had family members or friends that started using this on a regular basis?
100%. 100%. Like, I would never take it. I would never tell one of my friends to take it. Funny enough, I actually did one time. My friend broke her ankle and she was prescribed hydromorphone for pain, but she was prescribed 1 milligram tablets. To compare that to the Safe Supply, the one that we prescribe is 8 milligrams. So she was prescribed 1 milligram for pain, and I even warned her on how addictive that can be.
How many pills would you guess that you would dispense on an average shift?
Probably 1,000 a day.
1,000?
1,000 a day.
If 1 milligram of hydromorphone can be dangerous and addictive, you can imagine how dangerous the 8 milligram pills are that are freely handed out to addicts. But perhaps that is the point. Pharmacies are a business like any other, and they rely on a steady stream of customers. And with the addictive nature of hydromorphone, it's big business for these pharmacies, and that has led to some shady business practices.
Can you also explain, there were some scandals in the downtown east side that you also saw about what was going on between the pharmacies?
Yeah, so I think it's more prominent on the downtown east side because there's so many pharmacies. Like, you go down the street and you see, it's like Starbucks, you see pharmacies on every single corner. But when you're somewhere like Vancouver where there's so many different pharmacies, it's like, what makes a patient want to choose this pharmacy or the other pharmacy, right? A lot of the pharmacies on the downtown east side will provide like monetary incentives to their patients to come to their pharmacies.
Essentially kickbacks?
Yeah, like.
And you saw that? Like it wasn't.
Yeah, like it was normal. And then pharmacies will offer more and more money because they want those people to come use their pharmacy, basically.
Because I guess if it's a daily thing and it's for a whole year, it could be $10,000
exactly.
$10,000 in business for them.
So you offer a patient $100, it's the whole world to them, but it's nothing to these pharmacy owners based on how much money they'll make off of them.
Illegal business practices aside, maybe paying addicts to take Safe Supply is a good thing. That is, if bribing an addict to take hydromorphone means they won't take fentanyl, shouldn't that decrease deaths from overdose?
Since the introduction of these so-called safe supply drugs, have you seen that help with reducing fentanyl and fentanyl overdoses? We had very little fentanyl in London prior to Safe Supply. Since Safe Supply, we now have a huge problem with fentanyl in this city. There has been an increase in overdose deaths, an increase in use of fentanyl, and a decrease in the cost of fentanyl in the city as well. The presence of hydromorphone is not touching in any positive way fentanyl on the street. If anything, it is fueling it.
But how could it possibly be that giving people a replacement for fentanyl would somehow increase their use of that exact same drug?
Addicts want fentanyl, right? They want the big high and the big hit. They pursue fentanyl because it's a superior high to what they're getting from these hydromorph pills.
It was just about chasing the next high. It was just about getting high. It didn't faze me. The stronger the drug was, the better. That's what people would go look for.
Really?
Mm-hmm. Because the stronger it is, the better. If you know people who are overdosing on that, that's the stuff that people want.
Really?
Mm-hmm. Because that's how, I guess, the quality is better. When people are overdosing on it, okay, well, that's the stuff I gotta get. I didn't even care, I didn't care about my life.
Mm-hmm. Do you ever have any experience with seeing patients when it comes to this so-called safe supply of not adhering to how they were supposed to take it or not taking it at
Every
all?
single day. Every single day. They're either injecting them or they're taking all of them at once, or they're not taking them at all. And that's the not taking them at all is where I have the biggest problem.
And why would they not be taking them at all?
To sell them, to make money.
And so they'll take their daily supply bottle that they get and they'll sell it on the sidewalk and they'll use the money to buy fentanyl.
Right now, for example, I am seeing a patient who is prescribed 40 tablets of D8s that are allotted 8 milligrams every day. We have her on 9 in a day. That means she is likely selling 31 of the 40 pills that she is prescribed.
What many Canadians might not understand about Safe Supply is that most addicts don't want to take the prescribed drugs like hydromorphone. Instead, they get prescription Safe Supply drugs with the purpose of selling them so they can purchase the drugs they actually want, like fentanyl. And according to the BC pharmacist I spoke with, patients of her pharmacy don't even bother hiding this fact.
I see it, quite literally see it, every day. I will see patients come into the pharmacy and they will pick up their prescription, walk out of the pharmacy, and hand a bottle of pills over to somebody and have a cash exchange and sell their pills.
And how easy would it be for someone to walk over there and get...
Easy.
Yeah.
Very easy. It's there's no control over the medications. My kids could walk around the corner and easily get it.
Mm-hmm. People would be prescribed these medications, and there would be people waiting outside the pharmacy in one of the towns here. Mm-hmm. They would be waiting outside the pharmacy because they knew someone was going to eventually come out and sell their prescriptions.
It's become so common to sell your prescription Safe Supply that dillies are like a type of currency now. Oh, you want a blanket? Okay, give me 2 dillies and I'll give you this blanket that I found. Or there's the monetary value of selling it. And most oftentimes, patients will sell their Dilaudids and then go buy something stronger.
It took us about half an hour on East Hastings Street, and we were able to buy 26 tablets. We're told this is hydromorphone, also known as dillies, also known as Dilaudid.
Total price, $30. A little more than $1 a pill.
I almost feel like sometimes I'm like, this has to be a joke. Like, this isn't happening, right? Like, it's like even people know, like, I'm gonna go wait outside of this pharmacy and that person's gonna go in there and get their dillies and then I'm gonna buy it. And it like almost makes a joke of what we're doing. It makes a joke of the pharmacies, it makes a joke of the clinics. Anybody knows that they can just sit outside a pharmacy and buy it. You could go sit there right now and watch it happen. It's very, very in the open. They don't even try to hide it.
Far from trying to hide it, sidewalks around the Safe Supply pharmacies, like this one in Nanaimo, had it all out in the open. The remnants of consumed or traded Safe Supply littered the streets. a phenomenon that anyone living close to one of these pharmacies in a safe supply province can tell you is a new feature of Canadian cities, no matter their size.
I read an article the other day in Nanaimo, I think it was, where they just found, routinely pill bottles littered all over the place from addicts getting their supply and dumping the bottle and selling it.
Colin Middleton, a resident of downtown Nanaimo, lives a block away from a safe supply clinic and pharmacy. After moving to Nanaimo from Calgary, he started to notice a pattern in the garbage littering his street.
Late last year, I was just kind of picking up trash on the sidewalk outside of my house. And I came across, a label. I picked it up, looked at it, I was like, I didn't know what hydromorphone was. Why would somebody peel off the label? So then in January, I found another one. I was like, okay, this is a pattern now. But before I knew it, I had over 80 of them. One day I went into the pharmacy, I said, look, there's obviously a problem here and you need to deal with this. And the pharmacist sort of said, there's not really much we can do. Go talk to the doctor, tell them what you think, or take it up with the province or whatever. But it's only been since then that I've come to understand that our medical profession already knows this is happening as a way for, quote, safe supply of opioid medications getting into the street supply.
Shockingly, a handful of doctors that prescribe safe supply are not only aware that the hydromorphone is being diverted, they seem not to care.
Best case scenario, the doctor will be like, okay, that's not right, let's discontinue it. This patient clearly does not need it for themselves. It's not safe, let's discontinue it. But I've also had situations where I've told the doctors that the patients are selling the medications and they don't care. And I have had doctors tell me, well, that's okay if they're selling because that means that somebody somewhere is getting a safe supply. So it's just crazy how something that was supposed to be meant to help people, what I'm finding is the people that are buying these pills, it's sometimes people who have never even tried opioids. And what bothers me the most is that I see young kids coming and buying these pills. The hydromorphone is ending up in the high schools now. And it's become so normalized in high schools that you can walk around in high school and just ask for dillies. Really what the safe supply is doing is it's just creating the next generation of people who have opioid use disorder.
This is a 16-year-old girl currently in recovery from hydromorphone addiction.
When did you first hear about hydromorphone, or what kind of names are people using for it on campuses?
So obviously being young, you don't know too much about what everything's called, what the professional names for, let's say what it is. So it would be dilly or Dilaudid and stuff like that. Nobody ever really calls it hydromorphone or anything like that.
And when did you first hear about it? Do you remember, or when did you first notice people using them? Or
I'd say when I started grade 10, beginning of grade 10, so beginning of last year, it almost destroyed my life.
Thanks to our own government introducing safe supply drugs like hydromorphone into street circulation, it has now never been cheaper or easier for children to get their hands on highly addictive and deadly opioids.
Are people using it, you think, even younger than grade 10?
I see 14 and 13-year-olds using hydromorphone. Sometimes even 12-year-olds. It's I hate saying it out loud because it's you almost don't want to believe it. It doesn't seem real at all, but it's so real.
I am now seeing much younger people than I've ever seen in my life. I even had a 15-year-old patient who is in grade 9 tell me he started when he was in elementary school.
And what kind of opioids are these?
It would have been Dilaudid.
At the direction of our federal government, hydromorphone has flooded our streets and into the pockets of our children.
Did you think it was safe and your friends?
Yeah. 100%. Me being young, trusting the pharmacy and assuming this can't harm me in the long run type of thing. And it wasn't the case at all, no.
We would see patients come in for fentanyl use disorder. And now, come 2023, about half of our new intakes are addicted to hydromorphone. I saw it coming. I hoped it would never get into the high schools. But yeah, she came through our doors and I almost felt like crying. It was like my nightmare came true.
Does it seem weird to both of you that, I mean, this is notionally brought in obviously a safe supply as part of harm reduction. Do you feel like it's creating more harm?
100%. 110%. Most people who are using this have never tried drugs before this, like not opioids or anything like that. So it's just straight to the opioids. Like, it's definitely creating a lot more addicts than there was before.
How did this happen? How did we find ourselves in this dystopian reality? Well, according to Marshall Smith, this all began with another medically prescribed opioid, OxyContin.
So this really started with a company called Purdue Pharmaceuticals. They are widely credited for these actions. They doctored the research that went into the safety and effectiveness of their product. They infiltrated the medical regulators. They did everything that they could to get their product, into the hands of patients. And of course, because there was so much of it, going out onto the street, dealers would get it and remarket it, which is often what's happening with these safe supply drugs now.
After decades of devastation, the BC government launched a class action lawsuit against Purdue Pharma for their role in fueling the BC addictions crisis. But ask yourself, how is government-funded safe supply any different than Purdue selling of OxyContin? Especially when you consider that Dilaudid, the brand name for the hydromorphone currently being distributed by the government, is manufactured by the exact same company.
You saw all of the damage that was created by OxyContin in the community. Hydromorph is 2 to 3 times stronger than OxyContin. Stronger than OxyContin, for sure. So this is a way bigger, issue.
But OxyContin caused the problem in the first place.
Yes.
So the government went after Purdue,
yes,
kind of took their pill bottles off the street,
yes,
and then are supplying a drug that is basically the same except even more powerful.
Yes. So they're doing the same thing today that they are currently suing these companies for doing 10 years ago. Except
the drug's more powerful.
The drug is more powerful, yeah.
It doesn't even sound real saying this, but like I have patients who the whole reason that they became addicted to opioids was because one time their doctor prescribed them OxyContin. They got hooked. So I have those people who are now getting this prescribed safe supply. They're selling to other people who are just gonna end up in this same thing. Like it's just this circle.
During the huge ramp up of legally produced, clearly labeled, consistent quality prescription opioids, more Americans and Canadians died of those legally produced opioids than died in World War I and World War II combined. And that is very, very recent history. We got here from companies saying this same line of reasoning, don't be opioid phobic, we're gonna prescribe these very generously, we'll give them out in the community in all kinds of ways at a much higher level than we ever have. And because they are FDA approved or approved by Health Canada, they're safe. And millions of people got addicted, hundreds of thousands of people died. And we still have people dying from those medications today, including, by the way, a number of the people who are dying from street fentanyl. If you follow back their story, they started on one of those, allegedly safe, opioid prescriptions.
I started using Percocets, and then, I just kind of went downhill after that. I was like sleeping in alleys, or sometimes I wouldn't even sleep just because like when you go to sleep, people steal your stuff. So at night I'd like do a shot. They're called speedballs, where you mix fentanyl and meth together.
What was kind of the first pill that you started doing?
The Percocet.
What's the Percocets?
Yeah. Grew up in a really good family. Both of my parents were together. It was just the people I was hanging out with at the time had the drugs, had the beans, and after that first line, I just continued to want it.
It started off with Tylenol 1s, and when I no longer needed them, I found that I was still abusing them. And then from there, it just kept going. then Tylenol 4s, and then Percocets, then morphine, and then it went to fentanyl. I remember one day I couldn't even walk. I found myself like crawling to use the washroom. I don't know how many times I had overdosed.
I probably overdosed maybe over 10 times.
Wow.
Yeah.
And did you have any close calls with fentanyl?
Oh yeah, I've overdosed like more than 20 times, I believe.
Really?
Yeah.
I always thought that's how I was gonna die, was on the streets. It even got to a point where my family knew they were gonna lose me like that.
After you'd overdosed, did you accept the fact that you just might overdose and die one day, and that was just part of it, or did you not think about that? Or?
I didn't think about that. Yeah. All I thought about was getting high, really.
And what do you, as someone who lived it, what would happen if you go back to when you were on the streets and they basically went and they offered everybody who was using fentanyl, addicted to fentanyl, a prescription for something like a hydromorphone or oxys or Percocets?
Then they'll never get out of that lifestyle. That's just telling them you might as well dig your own grave.
We are creating something much worse than the opioid crisis that Purdue had ever started. One of the patients I have was not in the Safe Supply program. His neighbor was in the program. She would sell him about 10 of her Dilaudid in a day. So he was using all of the pills that he was getting and injecting those pills. He has developed, through injecting those pills, and that was the only thing that he was injecting, he has developed an infection low down in his spine, and he right now is not able to use his legs at all.
I'd be walking and they were giving out on me. I was falling down easily, and I'm thinking, why am I falling down so easily? And over the course of a couple of days, I wasn't able to walk. Anybody that I bought them from or that I saw with them were typically, they were using them intravenously. Okay. Definitely.
Did that addiction really kind of take hold of you with Percocets, or was it the later drugs that really
Right from Percocets.
Yeah.
Right from Percocets, and they're small amounts, but it was all it took. It's a big deal. It changes a person's life once, just with one pill.
The harm I'm seeing to individuals and to the community, there is nothing that can justify that. And I don't know how much suffering has to occur to get that message out.
Despite all the pain and suffering I witnessed on this journey, it also became apparent that there was always light at the end of the tunnel. That given the right supports and incentives, in some provinces at least, treatment was available and recovery was possible.
I went to jail in 2019 and got out in 2021, and that was like my turning point there.
It was either I go to jail or I go to detox, because I had drugs on school property, so I chose to go to the detox center.
I actually reached out for help one day. I knew someone who worked there. I asked her if she can call the detox for me, but I did end up going to detox that very same day.
These women were fortunate enough to have access to treatment and detox through Alberta's recovery-oriented system of care, a treatment-centric approach to combating drug addiction that has been introduced and greatly expanded over the past 4 years, and that stands in stark contrast with the strategy of other provinces of simply handing out free drugs. It is now known around the world as the Alberta model.
What is the Alberta model?
Well, the Alberta model is a model based, deeply on the belief that government's prime duty is to help its citizens restore themselves, restore their self-agency. And the model really is about eliminating barriers to access to care, improving the quality of care that is there, and utilizing, everything in our arsenal based on high quality evidence. And that evidence is, by and large, around the world. Our model borrows bits and pieces from jurisdictions around the world like Portugal, Switzerland, Massachusetts, and a lot of Alberta ingenuity, quite frankly, that has gone into it.
Like the Alberta model, the Portuguese system is famous around the world, but sometimes for the wrong reasons. Drug advocates in Canada often cite the fact that Portugal has decriminalized drugs, while ignoring the more nuanced measures Portugal has taken to combat its addictions crisis. A constant source of frustration for Stanford professor and expert in addiction, Dr. Keith Humphreys.
They also added something which people don't seem to know about in North America, which is dissuasion commissions. So it's not that if you use drugs in Portugal, no one says anything about it. Police can still grab you. They take you to a commission. It's not there to hurt you, but they do assess your case, and they may say, okay, you don't seem to have a problem. But if they think you do, they will say you need to go to this treatment program, and they can put pressure on you, and they can do some fines. They would not throw you in jail, but it's a very clear message from the authorities that what you're doing is not okay. And we want you to change.
What Alberta's trying to do, is it novel in the North American sense? Is it borrowing from what's been happening in Portugal, or what's your sense of what they're trying to do in Alberta?
It's a bit like one of those impressionist paintings. You have to back up long enough to see the whole thing. So first off, it is in fact a system. It's a recovery-oriented system of care. So instead of it being sort of the stepchild of the policy world where nobody wants to think about addiction, we'll build a few treatment agencies and that's all we're going to do. It's linked together, prevention, early intervention, harm reduction, treatment, and recovery, and across different sectors. So it's not just health, it's social welfare, it's education, it's criminal justice. That is critical to the idea of building a system. The second thing is it's animated with a spirit of hope. It is a recovery-oriented system of care. So the goal is not merely, let's try to modestly reduce overdose deaths and then we'll call it a day. The aspiration is way higher than that. It's saying we actually want people to get to the point where they're in recovery.
So today in Alberta, any person, whether they're rural or downtown Calgary, where we're at today, anyone can call our toll-free number and get an assessment right now and get started on treatment today. And so our median wait time for assessment and treatment in Alberta, in basically every community all across the province, is 0 days.
As part of the goal to extend treatment and recovery to all Albertans who require it, regardless of ability to pay, Alberta has begun construction of 11 large treatment facilities spread out across the province. In Red Deer, the first such facility is almost ready to open. A brand new building I was given a chance to tour with Marshall Smith.
Aaron, this is the first of 10 large recovery communities that we're building here in Alberta. These are different than the sort of normal treatment centers, which are short-term 28-day programs. These facilities are large, high-capacity facilities where clients can come and stay for up to a year at a time. It's individualized care with full medical services.
In the one in Red Deer, it's 75 beds, 50 on the male side, 25 on the female side. It's separated, they've got separate kitchens. And people are going to be put through the work. They're going to do the therapy in the morning and chores in the afternoon, or vice versa. They're going to have to learn how to cook, learn how to take care of themselves, learn how to take care of the facility, learn how to do some community gardening. Maybe we'll end up seeing some kind of farmer's market there. And we'll be coaching people through how to develop the life skills so that they can get their individual agency back. And then setting them on a pathway where they can pay it forward and help others. I think that is a much more inspiring vision than simply watching people slowly killing themselves, which is, I think, what the alternative approach has been. We won't give up on people.
And they are healing communities. But things are done in groups, right? And they live a very structured day. In contrast to the pure housing model, where people come in and they get a hotel room and that they can continue to use drugs in their hotel room, and there's no structure to that. I would say that can be very dangerous. And 75% of fatal overdoses occur at home on the living room floor. So if you're giving somebody a living room floor and you are allowing them to continue using drugs in your facility, the chances are you're probably going to find somebody dead.
Instead of warehousing addicts in hotel rooms like the BC government, these Alberta treatment facilities aim to build recovery communities.
Sure, well, we call them recovery communities for a reason, right? Because it isn't just the treatment of addiction that happens here. It is a reintegration into community. It's a rebuilding of community. When people are on the street, whether they're in tent encampments or you see homeless people gathering, that they do that because that is their community, right? That whether that community is attractive to us or not is irrelevant. Addiction is an illness of loneliness, despair, and isolation. And so the antidote to that is building facilities like this where people can come together, where they're not lonely, where they're not isolated, and where they're not in despair.
Any opioid vending machines here?
No opioid vending machines here. No. We're going to skip the opioid vending machines. As a government, we believe very deeply that our job as government is to be the cheerleader in chief. We have an obligation to provide the tools, facilities like this, like we do in all kinds of other areas of healthcare, to give the people of Alberta the best shot at recovery.
For this, the Alberta model has received international attention, hosting a global conference in 2023 to showcase to the world its early success.
Over the last decade, we've seen the issues of addiction, homelessness, and public safety grow and affect every community in Alberta.
Something definitely does need to be done in the criminal justice system, and you're bringing something that hopefully will get worldwide and fast.
Now in Alberta, first jurisdiction, I think, anywhere in North America, any Albertan, any time of day, anywhere you live, free of charge with no wait list, can receive treatment on demand, right? And that is unbelievable. Thank you very much.
But not everyone is on board with the Alberta model, particularly the advocates for safe supply, decriminalization, and harm reduction in British Columbia, some of whom have financial incentives to ensure the Alberta model doesn't succeed.
And the chief medical officer here in British Columbia came out and said that, if you're addicted to alcohol, we've got treatment basically that's available to you. But if you're addicted to opioids, you're kind of out of luck, and you're going to be addicted to these things. We're just going to basically ease your suffering as much as possible. So how does that make any sense?
The chief medical officer and the chief coroner are not medical experts in terms of addiction. And most of the things that they are saying are parroting activist and advocacy groups. I don't really know what's going on there, but we don't put any stock in that kind of narrative. People have been recovering from this illness for generations, for 100 years, and they will continue to. I think it's very irresponsible for people in positions like that to say such things, and I'm not sure what they benefit from doing that. After the pandemic, with our new system, coming on board, fatalities in British Columbia have continued to increase, and fatalities in Alberta are sitting at about 50% of what British Columbia is at. So, we will continue in Alberta to continue to save lives and to build an effective system of care to get people healthy, to help them regain their self-agency, and to restore themselves to sanity. And that is what we will continue to do, and that is what we are doing.
But where does my home province of British Columbia go from here? What happens if BC continues down the path of safe supply and decriminalization? Where does it eventually end up? Well, on the very last day of filming this episode, I stumbled upon something I've never seen or heard of before, even on the downtown east side.
So we're here in Vancouver on the downtown east side, and we're just walking, we're actually here filming something else, and we just came across a story and tracked down, and there's a new truck that's just pulled up here that is selling, presumably illegally, but in plain sight, cocaine, crack, MDMA, heroin, and crystal meth, or some kind of methamphetamine. So we've taken some shots here. We're not sure if anyone's going to talk to us. That's presumably the line of people who are currently buying these substances. I don't see police or anything anywhere, so not exactly sure what is going on, but such is life in the city of Vancouver.
I think it opened, this is the first day opening, and I'm going to buy some cocaine.
You think it's mainly cocaine, like people in mind, or just a mix of everything? Some people are here for...
I would assume fentanyl or heroin, right? I don't even know. I haven't even really looked at the menus.
So I think moving away from fentanyl is the best thing. Of course, you know, once you start doing heroin, fentanyl's the only thing that works for you, right? So that's why these people are, you know, zombied out on fentanyl. On the streets doing crime, robbing people, or breaking into businesses to support your habit. You know, if you're a detriment to the community, you know, of course it's a difference.
As we were about to leave, 3 men approached me and said they had just seen Vancouver is Dying, the prequel to this film.
Yeah.
You just watched the video, yeah.
Yeah.
Just like 25 minutes ago.
This is like a crazy,
yeah, no.
like double coincidence.
Where I was homeless for 5.5 years. Much like that guy who's now in politics in...
Marshall Smith, yeah.
Yeah, just a lot like him.
Yeah.
Right, we put a lot of effort into keeping this one area very clean, and then we have this going on right here.
Yeah.
A block down the road, we have a recovery house, treatment center, and it's right here.
Is it kind of, weird to you that there's like a block away from addictions clinic, they're just openly selling the same drug? How does that make you feel? You just walk in it?
It's kind of insulting, especially for people who are just trying to get in, and then they walk past, they have to walk past this every day.
Yeah.
Addiction is a disease of loneliness and isolation that says we do not have a disease. Right? It's a disease of more, and without recovery, it's a field day out there.